سوا على الهوا سوا على طول سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطن الموج كنا سوا.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
Good morning and thank you for being with us. This is Khalil Hachem, editor of WDMV, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. The show is brought to you by in cooperation between Michigan.com and US Arab Radio. Today is Tuesday, October 22nd, 2019. It's a bit cold, but the weather is still good. Enjoying the fall weather and the full day. I want to thank you for being with us. The number here is 248-557-3300. Please give us a call should you have a question or a comment. With us this morning is our dear friend Dr. Shamma. And before I introduce Dr. Shamma, I just want to let you know that, allow me a little bit of introduction, which is, reproduction is part of the human journey. Some of us are able to reproduce, whether it's a man or a woman. Some of us struggle to reproduce. There has been ample studies on what factors influence fertility, such as the environment we live in and other factors as well. With us today is Dr. Nicholas Shamma, world-renowned fertility doctor. He is a founding member of IVF Michigan Fertility Center and one of the leading reproductive and infertility specialists in Michigan and the Middle East. A Lebanese-American physician, Dr. Shamma has performed more than 8,000 IVF cases. I'm sure this number has increased because I made this announcement, a few months back. Cases worldwide and has more than 150 publications in the field. We are honored and delighted that Dr. is with us this morning. Good morning, Dr. Shamma.
Good morning to you, Khalil, and good morning to all your listeners on this actually beautiful day. I don't think it's that cold for us in Michigan.
Yeah, so it's not. Actually, it's very nice outside. Yes, you're absolutely right.
I love
and
it.
We're blessed. We're blessed to have this weather.
Yeah.
How do you enjoy the fall weather, Doctor?
Well, I enjoy it as much as we can here in Michigan because it's like a short period of time where we have good weather before actually winter comes, and it's eventually going to be interesting, like always.
Yeah. Any other special activities you do during the fall?
During the fall, actually, it's because I have a bunch of kids, so it's basically mostly with the kids. So outdoors with the kids and parks and whatnot. So, that's basically it.
Sounds good. Do you go
I can tell you, Khalil, summer is more fun because there's like the water activities and so on and travel. But in the winter, and sort of we get cocooned in our environments and concentrate on work and school and whatnot.
Absolutely.
Yeah.
Absolutely. I haven't talked to you for a while, and just wanted to give our listeners, because you normally speak with Layla in Arabic, and we're talking in English, and I just wanted to give our listeners a little bit of information about you. You're a phenomenal doctor. Could you tell us a little bit about your journey? You started in Lebanon, and then you came to the States. Tell us a little bit about that, please.
Well, I certainly grew up in Lebanon, and I came to the United States. I was around 24 years of age, and finished my last year of schooling at the university here in the United States in Boston at Harvard, and then went to Yale to do my residency and fellowship, my training and subspecialty training at Yale University, and have been in practice in Michigan ever since 1992, actually. And
wow, you're Michigander.
Well, I actually didn't know where Michigan was on the map before I came to Michigan, but since then it's been home. So for me, Michigan has a very dear place in my heart. My kids grew up here, and I've had all my 4 boys here, and my 2 girls came when they were young. So anyway, yeah, Michigan for me is home now, for sure.
That's good. Yeah, absolutely. How did you get interested in fertility?
Well, I'm going to tell you something. Fertility came as a happenstance. I mean, I just stumbled on it. Not that I was determined to get into infertility during my residency training, and it just happened that somebody, one of my professors at that time, the chairman, suggested that I go into infertility, and that was it. And it was a very nascent field. Yeah, it was a very nascent field when I graduated, because the whole field is brand new in the U.S. and on the planet.
Sure.
So for us, it was like pioneering days, because when I came to Michigan, there wasn't much of infertility done in a scientific way, and in vitro fertilization, we were the founders of the largest practice in the state to do IVF, and it's all history now.
Yeah, sure.
And that's why we have actually locations in multiple areas in Michigan, all the way from Petoskey, Charlevoix, Saginaw, Ann Arbor, Macomb, East Lansing, and our main office is in Bloomfield Hills. We have another one in Dearborn, and also we have one in northern Ohio, in Toledo and Sylvania. So, we have multiple locations, and we cater to all the aspects of infertility, and our laboratories, which is basically the engine of IVF Michigan, is where we do all this high-tech stuff related to genetics, related to in vitro fertilization. All of that done is in our main laboratory in Bloomfield Hills.
Tell us a little bit more about the high-tech stuff you're mentioning. What are you talking about?
Okay. Well, the high-tech stuff, in vitro fertilization in the past used to be like this. You take eggs, you take sperm, you try to fertilize, and you culture them for a couple of days, and then you put them and hope for the best. To put it in perspective, when I graduated from Yale years and years ago in '92, the success rate of in vitro fertilization on the average was somewhere around maybe 18%. Somewhere between 15 to 20%. Currently, with the technology that we have, and I'll elaborate in a little bit, it's somewhere around 70% for an average 30-year-old patient. And the reason for this is because we refined the technology behind in vitro fertilization, behind the laboratory part of the in vitro fertilization, and the procedures also were streamlined, and the ability for us to culture human embryos in the laboratory with the advent of new technology and new procedures became much more successful. So to put it in perspective, currently we are able to put a single embryo that is genetically tested to make sure it's genetically normal at 5 days of life and get a pregnancy rate of around 76% if that embryo is genetically normal. So that technology did not exist, was not even foreseeable when I graduated back in '92.
Sounds good. That's wonderful.
And again, it is that ability that allowed us to actually minimize one of the major risks of assisted reproduction or in vitro fertilization, which is basically multiple pregnancy. Because in the past, we used to put multiple embryos and result in a pregnancy rate that is barely acceptable. But sometimes it worked, and when it worked, there was the risk of high-order multiple pregnancy. Currently, with just putting a single embryo and therefore avoid almost totally the risk of multiple gestation, we are able to get a very high success rate when we do whatever it is that we do, and therefore help the patient and minimize the risks related to preterm delivery and all the sequelae from preterm delivery because of multiple.
Is it getting more expensive?
Well, actually, it's very interesting. When I graduated from Yale, we're talking back in '92, the cost of in vitro fertilization was around $10,000 back in Connecticut. In Michigan, the cost now is somewhere around maybe $12,000 to $15,000 if you actually add the medicine to it and monitoring. So if you think of how much healthcare basically cost increased from 1992 till today of every other aspect of medicine, this is actually minute compared to the cost of living and inflation, if you factor that in.
Absolutely.
So the reason that happened is because of the ability for us to streamline the technology and improve the technology so it doesn't have to be any more laboratory intense as it used to be. And like everything, when you get better in it, and do more of it, the cost of whatever that is diminishes. And that's basically why we are where we are now.
Absolutely. It's just, as you said, factoring the inflation rate into $15,000 is really nothing. It used to cost a lot of money to do that. On the and as you mentioned, since it is easier now, I think it's less stressful on people, and psychologically.
Well, I mean, imagine, Khalil, in the past, again, I'm talking like 29 to 35 years ago when I first started, we were talking about a success rate that happened to only 1 in 5 couples. Currently, 4 out of 5 couples eventually conceive. So, I mean, it's a dramatic difference in expectation, and we had to deal with the fallout of all those patients that are emotionally fragile, and you can imagine why, and yet have to deal with the ramifications of lack of success. Currently, thank God, we don't have to be in that position often. I mean, again, we're talking about good programs and good physicians that do that stuff.
Absolutely. I was reading the other day, it says, that, and the information, and correct me if I'm wrong, it says that today, with today's technology, even more patients that are older are getting pregnant than before. Is that correct?
Well, I mean, let me answer that question in 2 ways. Number one, more patients are delaying childbearing because of medicine, because of going to school, because of college, because of work, because of all that stuff, especially for women. That created an extra burden on them in terms of infertility concerns, and their fertility potential gets lower as women get older. So we have more patients seeking care at an older age group than used to be in the past. But because of the technology is advancing, the ability of those older patients to conceive became more available to them, and therefore, because it's more successful.
Sounds good. My dear doctor, what we're going to do is we're going to take a short break. We'll be right back. Please stay tuned.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
سوا على الهوا سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا.
من يوم اللي اتكون يا وطني الموج كنا سوا.
Welcome back, and we're talking with our dear friend Dr. Shamma about reproductive and the environment. And before we went on a break, quickly, we were talking about the success rates and how it is more successful now. Dr. Shamma, I met one of your patients, and I'm just going to mention his first name is Joe, and he mentioned to me not only how diligent you are, is how caring you are. How important is that in the process when you're dealing with infertility?
Well, I mean, Khalil, it is extremely important to be a caring person in every aspect of life. And care shows, and the patients that we deal with, as we said, are under a lot of stress, whether they're stressed because of the infertility and because of lack of having babies and because of family-related issues and so on. So they're very fragile, and it is important, and actually it is almost extremely important for us to show that we are caring and to actually be caring in the first place. So that for us is of paramount importance, because yes, we can give good medicine and we have good technology behind it and so on and so forth, but you have to be able to feel with your patients. And I mean, I can tell you, I feel so depressed one of my patients doesn't conceive, and I take it personal because for them, I can only imagine what they're going through. So to that end,
Absolutely.
of course, I'm caring. I mean,
Absolutely, and that speaks really volumes about you. And I remember going to doctors where they're a machine, they kind of touch you, this and that, and then they leave, and then they leave you hanging there. And then I remember going to doctors who are really caring doctors, and to me that speaks the process of healing, because I left there feeling good, although I wasn't healed yet, but I left there feeling good. And when he mentioned to me, how caring you are, he said, he treated me like I was his son. And I mean, it's like, oh my God, this really speaks volumes.
It is so true what you said. I, to some degree, tell my patients that I always treat them as if they're family members because they don't deserve less. They do not deserve less. And therefore, to that extent, every doctor is, besides being a physician and knowledgeable, we are all healers. We are all caring people, and we should be. And if we're not, we shouldn't be in that profession.
Absolutely. It's a people's field, and as you said, if it is a human, for duty and humanity, as the slogan goes.
Yeah.
And that leads me to our discussion today, which is the environment. That environment we live in. Does the environment that we live in have any effect on our ability to conceive or not to conceive?
Well, I mean, I think this is our discussion today. We should break it down into two parts. There is actually the environment in terms of the external environment, and then there are lifestyle-related issues. Because lifestyle is also part of the environment. So we actually define our ability to interact with our environments by our actions. An example of which, whether we smoke, whether we drink, whether we eat too much, whether we consume certain foods, whether we exercise or not. So that is our lifestyle, which is actually defining our environment. The other part has to do with the external environment, in my opinion, which is basically whatever environmental concerns we're surrounded by, and therefore that part of the equation has also ramifications in terms of our fertility potential and our ability to bear children and actually maintain a pregnancy even after women conceive. So we can divide this discussion, if you wish, this morning into those two parts so that we can address all those potential.
Sounds good.
Maybe we can start, if you wish, with certain issues that are pretty obvious. But maybe before I start, I want to mention actually a few things. Number one, in medicine, it's very hard to actually define causality, to say that something in the environment or our lifestyle affects an outcome that is a little bit remote from the immediate aspect that we're looking at. So basically, an association doesn't always imply causality at the end of the day. That's one. The second, most of the studies that have been done in this field in that context have been done in women, and there is less and less data as far as the association between lifestyle and or the environment on male concerns. The third one, which probably ought to be also put in perspective, is the fact that if you basically find an association, it is weak sometimes, but it is there. And sometimes the advice of us physicians is very simple. If there is a question of whether that issue or that concern affects fertility or not, just avoid it if you can, and that would give us a better outcome at the end of the day. So those things I just want to underscore before we actually delve into whatever lifestyle factor or environmental factor we're going to discuss this morning.
Absolutely. Now, you mentioned that more studies on women have been done than men. Why is that?
Well, I mean, it's obvious because, men, the only thing you can look at is whether they can make their wives pregnant, but then it depends on the wife whether she conceives or not. So there are those two factors of the equation. And most of the studies in men have looked at the effect of the environment or the lifestyle on semen parameters. But they didn't look at their ability to have offspring or to have pregnancies with their wives or partners. So, I mean, that is why. Now, the other part of it is that women are the ones that most often have to undergo procedures like in vitro or any other type of assisted reproductive technology, and therefore they have to go through the whole thing. The men just have to show up for one day on one morning, and that's the end of their journey from a biological perspective.
Yeah, they got it easy.
Well, I mean, to some degree, us men, you, me, others, I mean, we are fortunate that we don't have to go through 9 months of pregnancy with all the sleepless nights during and when the baby is born and after and so on. So that's actually it's a major advantage for us men. But on the other hand, we have other disadvantages. Let's put it that way.
Well, it's a lot of work on women, and we appreciate everything they do. I mean, carrying for 9 months and then caring for the baby, birth itself, and it's a miraculous. I mean, I remember when my children were born, and I'm just watching the whole thing happen. It's really a miracle. You have this human being coming out of another human being. It's just amazing. It's just really amazing.
Yeah, I mean, the more we know. The more that we know technologically and scientifically on how things work, I am every day amazed more than the day before about how things happen in nature. I mean, this is now like an existential thought on my end, because it's amazing that anything works. That for life to exist on this planet and for it to perpetuate itself is like beyond amazing, beyond miraculous.
I remember I had children at a later on life. I was in my 40s when I got married, and I remember when before that I really didn't care much for children, and then when my son was born, it is as if somebody turned on the paternal switch, and I became a different person. Just really amazing the effect on us. And maybe it was always in me and I ignored it. I'm not sure what it is. And now it just, this love between us is unbelievable.
Yeah, I mean, I share with you, but except that my switch turned on at 24. So I was a little bit premature, maybe too naive, but I mean, I enjoyed every part of the journey for now the past 33 years. So, yeah.
It's amazing. But you're never too young for that. People say, I'm too young. You're never too young for that. The Lord would provide.
Well, I mean, maybe thank God for the heavens, but it's a lot of work. It's a lot of work.
It is. It is a lot of work. It is a lot of work. So to go back, we talked about internal, external, and what are some of the internal environment effect?
Well, let's actually start talking a little bit scientifically here. Number one, I mean, you're talking about the effect of smoking. Clearly, smoking is an impediment to fertility, and that affects the chances of conception, and that affects the maintenance of pregnancy and complications during pregnancy. So clearly, you can think of smoking, and the more you smoke, the worse it is. The more you smoke, the worse the outcome. And we could talking about somewhere around 50 to 60% decrease in the chances of conception if you smoke, whether it's men and or women. More importantly, when people do procedures related to in vitro fertilization, the risk of smoking is absolutely somewhere around 50%. To the extent, let me tell you, when patients come to me and if they smoke, I actually tell them, no matter how much they pay me or whatever, to do whatever it is that I do. If they smoke, I will not do their procedures. Because I cannot, with all honesty, do their procedures and let them smoke and for them to torpedo their chances by 50%. It's just not in my book. So to that end, we absolutely advise them to do to decrease that. The second
before we move on this one, doctor, what does smoking do?
Well, I mean, for women, it causes direct DNA damage at the level of the eggs. So it's not just the nicotine, it's the dioxin in the smoke. So that clearly causes damage to the eggs. And the same thing happens to the sperm because all of those are, I mean, us men, we produce around 1,000 sperms a second. So you can imagine the effect of the environment on the ability to produce those sperms, especially, again, the nicotine and or the dioxin in the smoke.
Okay.
Clearly, I mean, it affects the ability of cells to replicate and so on. It damages them from a DNA point of view.
Okay, sounds good. Okay. And then the second thing you're saying, I'm sorry?
I mean, I was going to say that apart from smoking, Khalil, there is like the issue of weight. Clearly weight affects the chances of conception, whether it's for men and or women. And it's interesting because there's a tendency of people that are currently overweight marry people that are more likely to be overweight. So it's hard to actually tease how much is male being overweight affects fertility and women overweight affect fertility, but clearly both of them affect the chance of conception. For women, it's a more dramatic thing because it makes them less likely to ovulate the more they gain the weight. And think about this, 2/3 of the women in the United States are currently either obese or overweight. So that creates a major drawback in terms of the chances or the odds of success. Now, again, if you tease out the men out of the equation, if you control for male weight issues, female weight-related issues affect the success rate even in vitro fertilization. Sometimes, though, the question comes up is whether it's worthwhile to delay doing in vitro fertilization for the weight to actually go down in women. And actually, there are studies to show that that doesn't help. So it is better off, even though the rate might be less, but it is worse if we delay years and years for the weight to come off before we do IVF. So to that extent, well, it is because women get older. Because women get older and the chance of conception dramatically decrease and the chances of pregnancy losses because of miscarriages dramatically go up as women get older. So we don't know why, to be honest with you, as far as the biological answer, but clearly from studies' point of view, it clearly shows that you're better off going aggressive at the younger age than waiting for the weight to come off and try to conceive later. Now, men, as far as weight is concerned, clearly it affects their ability to even have sexual potency and so on, apart from it affecting negatively the semen parameters and their chances of their wives getting pregnant. So to that extent, related to weight, Khalil, it's an interesting part, which is where does exercise play a role? Exercise clearly is important for women and men. So it's important for women because exercise allows them to become healthier, and clearly it has been shown that doing exercise improves their ability for them to ovulate better. Now, if exercise, though, is associated with significant weight loss, we're talking about weight loss that is significantly diminished, then that affects negatively for their ability to conceive. But exercise in general, especially moderate exercise, is beneficial for men and for women. And vigorous exerise, we're talking about more than 2 hours a day, actually negatively affects the odds of conception for men and for women in the context even of in vitro fertilization. And again, to underscore a particular fact, a specific exercise that men sometimes do, which is basically bicycling, riding a bicycle, can negatively impact their odds of conceiving naturally or with in vitro fertilization. And the more hours you spend on the bike, because of constant trauma on the testicles and maybe because of heat. Remember, the reason us men, the testicles are outside our bodies is because they needed to be a couple of degrees lower than the rest of our core temperature. So the friction with the bicycle seat and or the trauma, constant trauma on the bike, causes, I mean, it's a fact that it causes decrease in semen parameters and in the ability to conceive. So those
I've always wondered why they are outside of the body. You know? I've always wondered why they're testicles outside of the body.
I mean, yes. I mean, they're outside of the body. Most mammals have their testicles outside their bodies. There are a few mammals, like you haven't seen a whale or a dolphin with the testicles outside, because then they act as anchors or as drags. So not all mammalian species outside the body, but most of them, because of that temperature-related issue, they're outside the body. Yeah.
Absolutely.
So to continue on terms of environmental factors, diet plays a major role. What type of diet we eat, what types of diet that we eat. I'll give you an example, especially that both you and me are Mediterranean. One of the best diets for fertility is the diet that you and me eat. Maybe that's why the fertility rate in the Middle East, despite the smoking, is better, which is our Mediterranean diet is the best diet, which is basically concentrated on legumes, on fruits, on vegetables, on less red meat, and so on. So all of those things, that diet has been absolutely shown to improve the rates of conception, whether naturally or using assisted reproduction. So you and me are on the right path, and maybe the proof is in the pudding. I'm just using you as an example because of you're on that side.
Yes.
So anyway.
Before we continue,
diet is very important.
Can we take a short break and then continue talking about diet? Please stay tuned.
Yeah, sure. Absolutely, yeah.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
سوا على الهوا سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطن الموج كنا سوا.
Welcome back. This is Khalil Hachem. We're talking to our dear Dr. Shamma in regard to the environmental impact on fertility and infertility. And then before we went on the break, we were talking about diet, and Dr. Shamma mentioned that Mediterranean diet is really very good for fertility. Could you elaborate more on that, doctor?
Yeah, I mean, diet, as we said, a lot of good qualities in it. We don't know exactly what's important. We just know that people who are on those Mediterranean type of diets do better in terms of the success of in vitro fertilization, and for the chances of conception naturally also is improved. So again, it could be because they have more in them, more antioxidants, because they have more in them what we call omega-3 fatty acids, because they have less saturated fats in them, and they have more polyunsaturated fats. All of those things are important, but it's hard to determine which of the factors in that type of diet improves the outcome. But clearly, unquestionably, it does.
Yeah.
Yeah.
Since
again,
we're talking about diet,
yeah.
Yes, I just want to stop you here, doctor, in regard to one of my favorite dishes, which is kibbe. Is it true that pregnant women shouldn't eat kibbe?
Yeah, I mean, let me tell you something. Kibbe is basically, for people that are listening, that most of us Mediterranean people know what it is. Kibbe that is cooked is wonderful. It's one of my favorite meals. But kibbe that is kibbeneye, as they say, raw kibbe, in my opinion, should be avoided for people trying to conceive, and especially during pregnancy. And the reason for that is because of Toxoplasmosis, which is actually more prevalent in the Middle East than here in the United States in our meat. But clearly, avoiding eating raw meat is a prerequisite and would be strongly advised for all women and men trying to conceive, especially women, and most importantly during pregnancy. So I know you like it, and I know you meant to ask me about the kibbenei, correct? But I advise you have cooked kibbe. I mean, cooked kibbe is good, Khalil. I love it.
Yes, it is. Do you eat kibbenei?
No.
Oh, okay.
Actually, I don't, because unfortunately, when I was very young, my early 20s, I did develop toxoplasmosis because I ate kibbenei. I had to have surgery for it. Yeah. So please avoid people that.
What is that complication for those who are not familiar with it?
Well, toxoplasmosis is a parasite that exists in cats, in cat litter, in the soil, and in kidney, in the meat only of cows, not in the meat of lamb. And it's a parasite that uses our body as a second host. The main host for it is actually a cat.
Okay.
Yeah, so you should avoid also, talking about environmental issues, pregnant women should avoid changing cat litter because of that toxoplasmosis risk.
Okay.
Sounds
good. And I think, I did a little study on Middle Eastern diet, specifically in southern Lebanon, and I found out that, older diet that did not have a lot of meat and poultry and fish, because, people really couldn't afford it, was a lot more, people really didn't suffer a lot of ailments because most of what they ate didn't really have a lot of meat except occasionally.
Well, I mean, there are plenty of studies, Khalil, that clearly show that if you eat too much meat, your conception rate decreases. And therefore, our Mediterranean diet doesn't really involve too much eating meat and concentrates more on legumes and vegetables and fruits and so on. And that's why probably, even though I cannot tell you for certain, that's why we have improved fertility than people that are not on those diets. Caffeine, we didn't mention caffeine because that's a question that always comes up with my patients, clearly a lifestyle-related issue. I would strongly advise, because studies clearly have shown that if you drink more than a couple of cups a day, which is basically more than 200 milligrams of caffeine per day, I mean, that, in a sense, is advised. So no more than 2 cups of coffee daily is sort of warranted and advised for people trying to conceive, whether men and women, because clearly, again, that affects their chances of conception. So all of those are lifestyle-related issues that we're surrounded with. Vitamins are important, Khalil. I mean, taking extra vitamins, whether we're talking folic acid, whether we're talking vitamin D, all of those are instrumental in the ability of women to conceive and actually to have healthy pregnancies. And again, whether it's vitamin D or whether it's folic acid, have been clearly shown to increase the success rates of in vitro fertilization, even in people undergoing assisted reproduction, like IVF. So those things are very important in our field, as far as that is concerned. Now, fish. You mentioned fish.
Yes, go ahead.
I was going to say something about fish, because fish is important. Fish, clearly studies have shown that if you have a serving or 2 a week of fish, you improve your chances of fertility, even in the context of in vitro. But I have a disclaimer here, I have a footnote. If you eat fish from Sweden, let's say, your fertility rate increases. If you eat fish from areas like the Great Lakes, where we are living now, because of the higher concentration of mercury, then that could be detrimental for in terms of chances of conception and or the success of IVF. That is because the fish in our environment around us, it has a higher mercury content than the fish that exists from open waters like Scandinavian waters and so on. And studies have clearly shown that. And it also depends on the type, because if you eat big fish, let's say you eat shark, or if you eat tuna, or you eat swordfish, and so on, that have a higher concentration of mercury per ounce of fish that we eat, then that diminishes your odds of success because it has a higher quantity of mercury in it. And now we're talking about more, not lifestyle, but environmental issues to dovetail on the second part of our discussion that we're going to have maybe in a little bit.
Sure. One more quick question about electronics. Does that influence, everything, the Bluetooth and waves and all of that? Does that have any effect on us?
Well, it's actually very interesting that you mentioned this. I'm going to answer you in three different ways. Number one, people that work in the electronics field, because they're exposed to glycol esters and to something called bromopropane and chloropropane, those solvents clearly affect their odds of conception, whether it's men and women. Using electronics is important, especially men who use laptops and put the laptops on their lower body while looking at the laptop. I mean, remember what I told you that the testicles ought not be fried?
Yes.
That's why they're outside the body. So frying them with a laptop might not be advised. So clearly doing that decreases the odds of having good semen parameters and affects natural conception. The third part that I want to discuss is video display terminals. So if you look at a video for 8 hours a day, there was some suggestion for at least women that it increases the rate of miscarriages, some sort of electromagnetic radiation. Except that the studies on this, Khalil, are not very good. So maybe it is just an association rather than it's an actual causation. So I am going to be very careful in whether I say that sitting in front of a video display terminal playing Fortnite or I'm just joking there, or actually watching or doing work affects your chances of conception. Yeah. How about cell phones? Maybe you meant cell phones. I don't think cell phones have any issue because thank God we listen either using Bluetooth or with our ears. We don't put that our reproductive organs. You can imagine men who put their phones near on their waist as a clip-on or whatever, then that electromagnetic radiation could potentially affect sperm production, but I can't tell you that there are any studies that I'm familiar with that have looked at that and looked at outcome. But I'm just conjecture on my end at this point.
Sure. What we're going to do, doctor, is we're going to take a short break before we get into the last part. Please stay tuned.
Sure.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
سوا على الهوا سوا على الهوا ياتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطن الموج كنا سوا.
Welcome back. Thank you for being with us. We've been talking to Dr. Shamma in regard to the effect of the environment on fertility, and before we went on break, we were talking about electronics, and we end up with the last thing we talked about was cell phones, and doctor, I see a lot of young people do that. They're sitting, their iPad is on their lap, their laptop is on their lap, and I think they're taking a lot of chances. Is that correct?
Yeah, I mean, can I tell you something? It is very hard to actually do adequate studies in that context because there's so many factors and that affect fertility, but at the same time, studies clearly have shown that if you increase the testicular temperature, whether it is because of wearing tight boxer shorts or whether you're putting your laptop on top of your lower body and so on, clearly it affects negatively your semen parameters for men and the chances of conception. For women, it does not seem to be the case. Remember, the ovaries are a little bit shielded because they're internal, so it doesn't look like it has the same residual effect. But I would avoid doing it anyway, even for women, because of the electromagnetic radiation. Because there is unquestionable evidence that radiation, not electromagnetic, I mean, we're talking about hard radiation like X-rays or like even gamma rays and so on, clearly negatively affect the odds of conception because they destroy ovarian and or testicular tissue, and the more you're exposed to those, the more you actually get negative effects. So talking about the environment, there is no question that radiation, ionizing radiation, affects negatively the odds of success. But there's a lot of things in the environment that affect this. Take an example, heavy metals. We mentioned mercury a little bit, but I mean, think about what happened in Flint with lead exposure, with cadmium, with nickel, all those heavy metals.
Yep.
There is no question all of them negatively affect the odds of conception and the chances of the pregnancy, being maintained. Clearly, those things ought to be avoided if we can. Again, I mean, there are two environmental things that surround us everywhere, Khalil, which is, one is called BPA, I don't know if you've ever heard of it, but bisphenol A, and the other one is called phthalates. Those things clearly have shown, because they're present in plastics, they're present in cosmetics that women use all the time. Clearly those two agents, BPA and or phthalates, affect the chances of conception and affect miscarriage rates. So they ought to be avoided as much as humanly possible, having less plastic-related products and more products that don't have those items in them.
Absolutely.
So, and again,
you were
mentioned something.
Yeah, go ahead. I'm sorry.
No, I was going to mention that I mentioned how important folic acid. There is a recent study to suggest that the extra folic acid that sometimes we give women might offset the negative effects of BPA as far as reproduction is concerned. So that is something additional to the advantages of folic acid at higher doses given to pre-pregnancy and for pregnant women. To elaborate on this further, I can tell you that environmentally, there is no question that heavy metals affect. There is no question that we are exposed to a lot of solvents in the environment. And there are certain professions, whether you're in the, let's say, petroleum or petrochemical industry, whether you are in the woodworking industry where you're exposed to solvents, you're exposed to formaldehyde, whether you're exposed to ethylene-related products, all of those things negatively affect sperm function, affects the chances of conception, and affects miscarriage rates. So people ought to avoid all of those environmental issues, especially organic solvents, when they do work or in their home or in their environment. Yeah.
We have about 5-7 minutes left, and we're gonna make sure that we answer all the questions that you had on your agenda. Did we get to all the points, Doctor?
No, I think basically that's it. Let me briefly sort of put the whole thing in perspective. Having a healthy lifestyle, whether utilizing better diet, better exercise, better food products, avoiding toxins in the environment, all of this is warranted, advised, and ought to be implemented. So this is my advice for all men and or for women. The other part of the equation, which has to do with lifestyle, is try, especially for women, try to conceive at a younger age group, because we talked about that. That is also part of lifestyle-related dynamics and when to put fertility on the agenda. So it ought to be also exercised in that way. But generally speaking, I mean, that's mostly it. Avoid anything that you could misconstrue as potentially damaging, and therefore, even if the studies might or might not show it, avoid it if you have questions about it. And that's what I tell most of my patients.
Absolutely.
We didn't address
eating healthy, eating healthy, eating balanced diet.
Absolutely, Khalil. And we didn't address drugs. I mean, we're talking about not drugs like illicit drugs. Clearly, marijuana, cocaine, all of opioids affect negatively the odds of conception. But we're talking about drugs that people use for medical reasons. Before you use any drugs, and that's one message that ought to be underscored, is that if you use any medication for all women and men trying to conceive, they ought to have a discussion with their provider and tell them that, okay, we're trying to get pregnant. Is that thing harmful? Does that drug affect my odds of conception? Or does it affect my miscarriage rates? Or does it affect me during pregnancy? All of those things ought to be put on the table and elaborated on for whoever the patient is, and for all providers listening to us, ought to be discussed with their patients when they prescribe any type of medicine to any patient who is in a reproductive age group. I cannot tell you the number of men that are on medications that could wipe up their sperm, and yet they are given those medications. And one medication that comes to mind is testosterone and androgens-related products, whether prescribed by physicians or whether they're taken illicitly by patients just to improve their musculature. And I remember a few months back, Layla and I had a discussion on the radio as the effects of androgenic anabolic steroids on the odds of success for men. And I told her that wipes off completely the chances of success for men because it diminishes their count to zero in a lot of for men.
Does that also include medication when people grow in hair?
Well, there are medications. That's what part of the medications that we need to discuss. So most of the medications that improve hair growth are anti-androgens. So they're given for men like Propecia and so on. Those medications, Khalil, negatively, because they're anti-androgens, negatively affect their odds of success because they, again, diminish semen analysis parameters, sperm count.
Sounds good. My dear doctor, I really enjoyed. Yeah, go ahead. I'm sorry.
I thank you so much, Khalil. I was going to say that I thank you so much for allowing me to discuss all those things with you this morning. My regards to every single listener this morning, and I hope this was beneficial to them. The message is avoid anything that you can misconstrue as potentially harmful. Have a healthy lifestyle, and you, for all our listeners, have a great day and a wonderful week.
Thank you so much. As always, I've always enjoyed talking to you and listening to you and then giving us all this great information. And I hope that one day we'll meet in person.
You're welcome, Khalil. It's my pleasure. The pleasure is mine. And to all your listeners.
Thank you so much. Thank you so much. Appreciate it. Thanks, Doctor. And I want to thank all of our listeners. It's a great day. Today is Tuesday, and please enjoy it. Enjoy the time. And as Dr. Shamma mentioned, nothing beats being healthy, taking care of yourself. You know, whether you're trying for a child or not, we owe it to ourselves to be as healthy as possible. And, the environment and, reproduction is a huge topic. We try to tackle it as much as possible. There are other facets of it. Maybe, another segment we can talk about it. But, and that's the psychological aspect. We did touch on it a little bit, but, again, thank you so much. Thank you, everybody. Have a wonderful, wonderful day. Thanks again. Bye now. And thanks to Mike for producing this wonderful segment. Thank you, Mike. Bye now.